All right, so, okay, my name is Norma Sanchez, and I am in the microbiology lab class, and I have Professor Sarah Rogers and Mr. Caleb Bukoris. I'll be going over pure culture and how to prepare streak plate. Pure culture pretty much is when you have diluted a bacteria or a colony down to a specific bacteria from a plate that has mixed colonies in it. So what you'll first want to do is gather your supplies and make sure you disinfect your work area. You'll need your original plate with your original bacteria that you want to use and a clean plate. And then you'll need your loop and a Bunsen burner and a permanent marker to make sure you label your plate. And so on your plate with the original bacteria colonies, you'll pick the one you want to use, and you'll take your loop and you will put it through the Bunsen burner, sterilize it. Then you will run your loop through the bacteria that you want to use. You'll place that plate down because you're not going to use it anymore, and you'll grab your clean plate. And at this time, you're going to take your loop with the bacteria on it, and you're going to run streaks across the top of the plate. You want to do it on about a third of the plate. And then you're going to re-sterilize your loop, rotate your plate 90 degrees so that your streaks are now to the side. And you're going to take the loop again after it's been sterilized, and you're going to run it through those last streaks that you just made. At least one or two of those last streaks, you're going to run it through there, dragging, pulling the bacteria across. And again, you're going to streak back and forth and get some good streaks in there. All right. And then you're going to take the loop again, put it through the Bunsen burner, re-sterilize it, rotate the plate again, and take your loop once it's been re-sterilized and put it through the last streaks you made. And again, pull the bacteria across, and you're going to streak. So what you're doing is the most concentrated bacteria is at the bottom, and you have just diluted it on the plate. So you'll re-sterilize your loop and put it away. At this time, your plate, you're gonna let it incubate for 24 to 36 hours. And let's see, what's the other question? So your desired outcome is you want to have the most concentration where you started your streaks, and then the least as you ran your streaks. And that way you can that way the bacteria is isolated. And once you have you'll take that bacteria and you can test it. We said we were using the urine culture, so you can test that under a microscope and see what kind of bacteria it is, or different chemical tests they could use, see what kind of bacteria it is, so that the patient, if it is positive for whatever germs cause an infection, they can get the right antibiotics. It's important to know what kind of bacteria it is, because some are don't take to antibiotics. So that's why it's important in the clinical facilities to be able to do these cultures so that the patient gets the right treatment. Then you would treat the patient with the appropriate antibiotics, and have them return if their symptoms persist. Thank you.